One of you recently wrote in the comments of one of my videos, you said, how often should I get my hemoglobin A1C checked? I'm going to tell you in this video, you know the hemoglobin A1C is often called the A1C or HbA1C. It's the 3-month average of our blood sugars, and it's often used to diagnose diabetes and also to track how on par or how controlled your diabetes is. So let me just jump right in and give you the answer, at least for what I do. Now, for my patients where we're trying to get their diabetes numbers to goal, maybe their A1C is not quite where it needs to be and we're trying to get there, maybe we've made some changes with medications, adjusted a few things, I'm checking that hemoglobin A1C every 3 months, okay? For my patients, and by the way, I'm focusing on type 2 diabetics in this video with the A1C. For my patients who are well controlled, meaning their A1C is rock solid, they're doing great, we're stable, I can pretty much go every 6 months with them. Now, every now and then I might have a patient where I might sort of split the difference. I might ask them to come back every 4 months, depending on whatever else is going on in their life and things like that. But usually we do a minimum of 3 months. You might say, well, can I get my A1C done like after 1 month? Well, theoretically, you can, but you probably shouldn't. Remember, the A1C is a blood test, but the thing about it is that the lifespan of the A1C is about 90 to 120 days. Remember that A1C is a 3-month average of your sugars, so if you get that A1C done before 3 months are up, you're probably not going to see the full benefit of whatever interventions you're putting into place, okay? Now, remember, the hemoglobin A1C measures how much sugar is attached to hemoglobin, which is a part of your red blood cells. This gives us an idea of how controlled you are, and it tends to be more accurate over the long haul than, say, a fasting blood sugar. By the way, before you go anywhere, I have a whole video playlist on YouTube on all my diabetes videos. I have a video on what is the A1C and what the A1C should be for you. I want you to watch that video next, by the way. If you're watching on Facebook, please ask for it in the comments so I can give it to you. On YouTube, the video will be linked, okay? But make sure you check this out. But yes, every 3 to 6 months. So what that means for those of you who are watching, if you're type 2 diabetic and you're like, wow, I haven't been to the doctor in 9 months. I ain't got lab work done in 9 months. You are overdue. Even if your blood sugars are normal. I'm telling you this so that even if your doctor hasn't called you back, you know, hey, I'm supposed to be in there at least every 3-6 months or something like that. You can't or shouldn't go a year or 9 months without getting your A1C checked, okay? All right, guys, I hope this is helpful. Write in the comments if it is. Let me know what other questions you have about diabetes, blood pressure, cholesterol, all the good stuff. My name is Dr. Jen Caudle. I'm a practicing family physician, on-air health expert, and video creator. I create videos all over social media, so if you're watching on Facebook, follow the page, like it, all that good stuff. Comment below. Let me know what you think about this video. Subscribe to my channel on YouTube. Also, I have a free health newsletter that goes out every week. You can go to drjencaudle.com to sign up. You can get that. But anyway, let me know what you think in the comments. Let me know if this is helpful. Bye.